my name's Wehry. I'm a student nurse at Cedar Crest College, and I'm going to be presenting some information on research done on the paradoxical effects of a hospital-based multi-intervention program aimed at reducing medication round interruptions. The problem of this study was they were looking at how to reduce medication interruptions during medication rounds, and these interruptions could lead to an increase in the risk of errors. Significance of the study: there are 3 of them. The nurse's job is to administer medications without errors. Effectiveness of multi-intervention hospital-based program. In this study, there were a total of 3 interventions implemented that I'll talk about later. And their interruptions have negative effects on the patient's health in multiple ways. Some ways that could be affected are the wrong patient could be given someone else's medications, the wrong dose could be given, and then some medications have timeliness that is very important, such as antibiotics, insulins for diabetics. The study design was quasi-experimental design. The sample size consisted of 2 parts, T0, which is the baseline, which was before the interventions were implemented, and T2, which was after the interventions were implemented. The T0 sample size, there were a total of 945 medications administered. In T2, there were a total of 895 medications administered. The dependent variables are number, cause, and the length of interruption. The independent variables are the red tabard, which is a red jacket that the medication nurse would wear as they were going out on the floor to administer medications to let patients and staff know that they should not be interrupted while they're out there to reduce errors. The medication preparation room was used for this medication nurse who would go in and prepare their meds before they went out on the floor to hopefully reduce interruptions caused by the patients and staff. And staff education, which was letting the staff know not to interrupt this nurse while they were giving their medications. And the framework was unidentified. Materials and methods. There was pre- and post-intervention program study was created. The pre-intervention program would be the baseline T0 before the interventions were implemented, and the post-intervention program would be after the intervention was implemented. The 3 interventions, as I stated before, are dedicated medication preparation room, the red tabard, and the education of the staff. The results of the study were T0 baseline. There were 298 interruptions for the total of 945 medications administered. And within this, 1 in every 3.2 medications given had an interruption. The interruption duration on average lasted about 10.48 minutes. And then for the T2, after the interventions were implemented, there were 385 interruptions for the total of 895 medications administered. And within this, 1 in every 2.3 medications given had an interruption. And the interruption duration for these averaged about 5.08 minutes. Limitations for this study: it was conducted over a 4-year period, which could lead to changes over the years, such as different staff, different setup within the units, different rules and regulations on the different units in the hospital. The difference in compliance on different units, because there were a total of 7 units in the hospital that were studied. The nurses being studied could act differently due to knowing that they were being watched and studied by the researchers, so they might be slightly more careful than they usually would on a day-to-day basis. The number of caregivers varied with the different units and between the T0 and T2. The decreased number of nurses available on the units between the T0 and T2. Implications: nurses need to not get distracted when they're out on the unit administering medications. They should be prepared when entering a patient's room by having the medications ready and also having all of the supplies they need so they don't have to leave the room. And nurses and staff should wait to ask questions until the medication nurse is finished administering medications. They should not interrupt them in the middle because that can lead to errors. In conclusion, the strong decrease in the length of interruptions. So as we saw, the length of the interruption was at about 10 minutes and it went down to a little over 5. And then the number of interruptions increased. So the nurses were interrupted more in T2 than they were in T0. And then the decrease in interruptions caused by the patients. So the patients did not interrupt the nurses while they were out administering medications, probably due to the red tabard that they wore. They probably were scared to ask questions, which isn't necessarily good because they're not going to ask questions, so they're not going to be well educated about their medications, which they could have important questions and it could lead to complications and problems if they don't ask. But there was not a decrease in the staff and nurses asking the medication nurse questions, which was not good. And these are the references I used. Thank you. If you have any questions, please post them and I'll answer.